Welcome to Osage Casino Benefits Enrollment. My name is Sue with Shimento Insurance, and I will guide you through each of the current benefit options so you can select the plans that best fit you and your family. Osage Casinos provides each employee with a wonderful package of benefits designed to maintain the health of you and your covered family members. This includes medical, dental, vision, life, short and long-term disability, as well as accident, hospital indemnity, and critical illness. We also have an employee assistance program that is available to you. The following information will assist you in the enrollment process, but should you have any questions, please reach out to the Osage Casino Benefits Office, and they will be happy to help you. The benefits you select now will be in place until October 1st, 2021, unless you have a life-changing event. Again, if you have any questions or need assistance, please reach out to the Osage Casino Benefits Office. Thank you. It is helpful if you have all of the information needed when you sit down at the Benefit Harbor enrollment portal. For any person that will be covered, you will need to have their name, address, date of birth, and social security number. You have the ability to choose to add dependents to each program. Dependents include children, spouses, or you can cover the entire family. Some benefits are going to also require that you select a beneficiary. For each beneficiary, you will need the name, relationship, date of birth, and percentage of benefit that should be applied to that person. For example, in life insurance, you may have multiple beneficiaries, so have all of the requested information for each person. Osage Casino's enrollment is located on the Benefit Harbor Employee Self-Service Portal. From the Benefit Harbor portal, you select which benefits that you want to enroll in for the 2021 plan year. All plans and rates for the current year are loaded on the portal so you can see a running total of what you have elected and what your cost share for each pay period will be. The ID and password will be reset for the open enrollment window to your date of birth in a month, day, year format. If you have any questions once you get in the system, you can contact Benefit Harbor directly, or you can contact the Osage Casino Benefits Office, and they will be happy to assist you with logging in. Osage Nation offers 2 health plans through Blue Cross and Blue Shield. The theme of keeping you healthy follows both plans, and that all wellness is covered at no cost to employees each year. This includes routine physicals, mammograms, well woman exams, and immunization. The Blue Cross network is very broad, and it includes over 95% of all providers in Oklahoma, as well as providers nationwide. If you seek treatment outside of Oklahoma, you will still receive the highest level of coverage. The first plan is the base plan. The base plan includes the following coverage levels. Your annual deductible is $1,000 per person. The annual maximum out-of-pocket, which means the maximum that you would have to pay per person if you have a catastrophic event, is $2,500 per year. After you meet your deductible, the plan pays 80% and you pay 20% until you reach the annual out-of-pocket maximum. Once the out-of-pocket is reached, Osage Nation will pay 100% of the remaining charges. However, if you have to go to the doctor for an office visit, you do not have to meet your annual deductible. Office visit copays apply. The office visit copays, should you choose to see a provider in their office, If you have a primary care provider, the office visit copay will be $15 per visit. If you choose to see a specialist, a referral is not required, but the office visit copay is $25 for specialist. We also have a telemed option available through Blue Cross and Blue Shield, which is called MD Live. If you use the MD Live telemed program, the office visit copay is the same as the primary care doctor, which is $15. If you have to go to an emergency room, you do have a higher copay. The office visit copay for emergency room is $200 per visit. After the emergency room copay, you have to meet the deductible, and then you have to pay your 20% of the remaining charges until you've reached your annual out-of-pocket maximum of $2,500. The second plan, the buy-up plan, offers you the option to pay a little more per paycheck, but you have a few benefits that are enhanced. We have highlighted in yellow the benefit enhancements, which include a $500 deductible and an annual maximum out-of-pocket, which is $2,000. Additionally, the copays for primary care doctors has been dropped to $10 in the buy-up plan. The remainder of the benefits and the network is identical for both plans. The monthly medical cost for each covered tier is listed below. The monthly premiums are divided equally into per pay period cost, which are calculated on the enrollment portal. The amounts are based on each enrollment tier. For employee-only coverage, the base plan is $66.18 per month. But if you choose to buy up to the buy-up plan, the cost would be $88.25 per month. And again, those would be split into 2 pay periods. You can see if you cover your spouse or your children or your family, each has a specific rate. For example, children in the base plan would be $278.92 per month, where the buy-up plan would be $310.44 per month. The prescription drug plan is identical for both medical plans and follows the Osage goal of keeping you healthy. Osage pays 100% of generic prescriptions. You have zero copay for all generic medications, which covers most maintenance medications. However, if you are prescribed a brand name drug, the monthly copay will vary. If it is a Blue Cross preferred drug, meaning it's on Blue Cross's preferred list, the copay is $35. If it is not a part of the Blue Cross preferred program, the copay will be $60 per month. Keep in mind, if you have a copay that is $60, there is usually a generic you can substitute at the pharmacy or a preferred brand name drug that you can receive that is considered a chemical equivalent. However, to switch to a preferred drug, approval is required from your doctor. You may also receive your prescriptions directly at your home through mail order. You will receive a 90-day supply of maintenance medications delivered directly to your home through Alliance RX, which is part of Walgreens. MD Live is offered through Blue Cross, where you can have the opportunity to utilize a virtual medical visit for the same office visit copay as a primary care visit, which is $15. MD Live is accessible 24 hours a day, 7 days a week. To set up the program, you can download the app from the web address listed. You can access it through your phone or your computer, or you can even call and talk to a doctor live. It is great for minor things such as allergies or pink eye. Once the visit is completed, the doctor will call in the prescription to the pharmacy you select. You can even use it when you're on vacation. The website is listed below. In order to register, you must have your Blue Cross member ID. Osage offers dental benefits through Delta Dental. The plan pays 100% for preventive services, including 2 cleanings and 1 set of x-rays per year. After that, you have an annual maximum of $1,500 with a coinsurance that varies depending on the type of service provided. For example, the basic plan pays 90% for services such as fillings and extractions. Major services such as oral surgery and crowns are paid at 60%. The plan also includes orthodontics for children to age 19. The orthodontics has a $1,000 lifetime maximum, which is paid at 50%. You pay 50%, the plan pays 50% until you've reached $1,000 from Delta Dental. Please check the Delta Dental website or download the mobile app to look for providers in your area to maximize your benefits. Delta Dental has a broad network in Oklahoma covering over 90% of the providers in the state. Following the guides of keeping you healthy, Osage pays 100% of employee-only coverage. You can add coverage for your dependents based upon the monthly rates that will be divided in per pay period amounts on the enrollment portal. The rates for each dependent tier are listed below. Vision benefits are provided by Vision Services Plan, which is the largest vision provider in the country. The Osage plan offers coverage every year for exams, frames, lenses, and contacts. Each benefit has an annual maximum, but VSP will provide discount for additional services such as a second pair of glasses or additional contacts if needed. Please check the VSP website for monthly specials as well as a listing of covered providers. The costs are broken down to monthly rates for employee as well as each dependent tier that will be divided equally into pay periods. Short-term disability is covered 100% by Osage. Should you have an event such as an accident or illness that requires you to be away from work, short-term disability helps replace your income while you are off. The maximum leave is 26 weeks that you would be eligible for up to 60% of your weekly salary to a maximum of $1,385 per week. Cigna will notify you of your approved benefits once the claim has been processed. A common example of short-term disability is a pregnancy. The plan helps continue to receive part of your income while you are off with the baby. Again, this is 100% paid for by Osage, but you must select the benefit in the enrollment portal to be enrolled. Osage provides basic life and accidental death and dismemberment insurance to each employee. The full cost of this coverage is paid by Osage. The benefit is 1.5 times your annual salary with a minimum of $50,000 per employee. For example, if you make $50,000 per year, your total benefit would be $75,000. However, if you make $20,000 per year, you will still receive a minimum of $50,000 in life and AD&D benefit. Life insurance does require each employee to submit beneficiary information. Please complete the beneficiary selections on the enrollment portal. Multiple beneficiaries may be designated. Keep in mind, children under 18 should not be listed as a beneficiary if possible. Voluntary benefits are a set of plans that are offered by Osage and gives you the benefit of a large company plan, but the employee pays the cost for each benefit plan. These include additional life insurance, long-term disability, accident, critical illness, and hospital indemnity. Each plan will be outlined in detail. Long-term disability is offered by Osage on a voluntary basis. Long-term disability continues income replacement after your short-term disability period of 26 weeks is exhausted. The benefit is 60% of your income up to $5,000 monthly if you have an approved disability that prevents you from returning to work. For example, a stroke, or if you're having cancer treatments. The cost is based on the amount of your current salary and will be calculated in the enrollment portal. Employees may want to purchase additional life insurance or add coverage for spouse or children. The voluntary life plan allows you to purchase up to 5 times your annual salary in increments of $10,000 for employee coverage. Spouse coverage may be purchased up to 50% of the employee amount for the voluntary election. Children may be covered up to $10,000 if the employee purchases at least $10,000 of voluntary life. Guarantee issue amounts are allowed at each enrollment period, provided you already have a voluntary life election. If you do not currently have voluntary life insurance or want to purchase amounts above the guarantee issue level, you will be required to complete an evidence of insurability form for the requested amounts. The EOI must be approved by Cigna before the benefits are effective. Rates for employee and spouse are based on age and will be calculated by the enrollment portal. Child rates are flat and cover all children for one price. Critical illness pays a flat amount directly from the carrier, Allstate. You can either select $10,000 or $20,000. If you are diagnosed with one of the covered illnesses, including heart disease and cancer, the benefit pays the flat amount to you that you can use for whatever you choose. It may help with your medical out-of-pocket cost, or you may need to help pay your mortgage while you're away from work. It is completely up to you. The benefit portal has a detailed list of services as well as opportunities to receive payments back from Allstate for wellness services as a bonus for utilizing the plan. The rates are based on 2 criteria, your age and your smoking status, and they will be calculated on the enrollment portal during the enrollment process. The accident benefit from Allstate pays cash directly to you if you are injured due to an accident. It will pay up to $1,000 for a hospital admission, an additional $200 per day if you are confined in the hospital. The benefit also has a schedule that will pay different amounts based on what is injured. For example, if you break a finger, you have a reimbursement benefit, but you will have a larger benefit if the injury is more severe, such as a broken hip. The benefit portal has a detailed list of services as well as opportunity to receive payments back from Allstate for wellness services as a bonus. The rates are listed below based on the coverage tier that you choose. Hospital indemnity is provided by Allstate and is designed to pay a flat benefit to you in the event that you are admitted to the hospital. The benefit is a flat $500 per admission and $100 a day up to 10 days of confinement. Additional benefits apply to ICU admissions. This plan might be a good idea if you selected the base medical plan, as it would pay the additional $500 deductible over the buy-up plan, but you have the freedom to use the benefits however you want. Pregnancy does have a 10-month waiting period if you are not currently elected with the benefit. The rates are listed below based on the members that you want to cover. Flexible spending accounts offer you the opportunity to have funds deducted from your paycheck on a tax-free basis to cover eligible medical or dependent care needs. Examples would be pharmacy copays or daycare costs. The annual healthcare limit is $2,750, and the daycare limit is $5,000 per year. Healthcare services are defined by the IRS code, but include out-of-pocket costs for medical, dental, and vision, as well as an entire list of other services. Dependent care covers children under age 12 or qualified adults. Charges must be validated through the plan manager, Benefit Resources, when submitted. For example, if you use your FSA card to purchase food instead of allowable expenses, your card will be turned off until the account can be reconciled. This benefit is wonderful because it allows you to pay for these expenses tax-free. However, the IRS requires that all funds be used within the plan year or they will be forfeited back to the IRS. The IRS will allow you to roll over up to $550 of the unused money in the medical plan only. Keep this in mind when electing the benefits. Osage offers an employee assistance program through Community Care that is available for all employees 24 hours a day, 7 days a week. You are eligible from the date of hire to access these services. Services include confidential counseling for personal or financial issues. For example, you may be having a hard time communicating with your child and need an unbiased perspective on how to open those channels. Community Care does not share any data with Osage and maintains complete confidentiality for all services. If you need support beyond the scope of the plan, Community Care does a great job of referring you, for example, to a counselor under the Blue Cross Medical Plan. In order to begin the enrollment process, please log in to the Benefit Harbor Resource Portal. All of the plan summary and detailed plan guides are included in the portal to provide information beyond what has been included in this presentation. Just to remind you, your user ID and password have been reset for the open enrollment period to the month, day, year format for Osage casinos. If you have any questions or any problems logging in, you can contact Benefit Harbor directly, or you can contact the Osage Casinos Benefit Office. Thank you.